Hi, this video is the demonstration of the FUT linear scar, FUT or FUSS, Follicular Unit of Transplant or Follicular Unit of Strip Surgery, where we harvest by the strip and close you down, suture you up, you have a linear scar. There's always pro and con for both, and the result vary from one individual to another. Some of them can be smaller, and some can be wider and stretch. And it's really not just the surgeon, but it depends on the client and how the body create the scar. And I perform both the FUE and FUT, and there's always pro and con for both. So the strip method will leave you a linear scar, where the FUE leaves you tiny dissect scar. So the downside of the strip method are the linear scar is more visible to the eye. If you cut your hair short, they'd be more visible. We cut it open. It's slightly more invasive than the FUE. Again, both of them are minimally invasive surgery, and that's why we do outpatient, go home. It's a little bit longer healing, but not a lot. It's only 2 days longer. The other downside is it's a little bit more painful. There's some numbness along the linear scar. But on the other side, the FUT or the strip method had their benefit. The pro for the FUT is a lot cheaper. It's almost 50% cheaper because there's less labor. The pro for the FUT are you can harvest bigger number of grafts per day. So it's better for advanced hair loss. So most clients with advanced hair loss, they more inclined to opt for the strip method, because you can, like class 5, 6, or 7, where you can harvest 4, 5, 6,000 grafts per day, and then you reach your goal faster. And where the FUE, we can do around 25 to 3,000 grafts per day, although there are days I can go beyond 3,000. So the FUE is more for mild to moderate hair loss, the FUT more for advanced hair loss nowadays. And then number 3, compare the two methods. Now I'm going to give you good result with both FUE and FUT. I'm a specialist on both FUE and FUT. But if you if you compare my FUT or the strip method versus my FUE, the FUT will grow 10% better density than the FUE. On the other hand, the FUE, there's always pro and con. The pro of the FUE is less invasive, less bleeding, less chance in infection. You heal faster. You leave tiny dissect scar, allow you to shave your head shorter. But the downside of the FUE it's a lot more expensive. The number of grafts we can do is less, 25 to 3,000 grafts per day. Although there are days we can go beyond 3,000, and the number of grafts we can harvest, again, that's less than the FUT. FUT can go up to 6,000, and then the growth rate. Again, I perform both FUE and FUT, and you will have excellent growth rate and excellent density with FUE and FUT. However, if you compare my FUE to my FUT, it's 10% less density. This is the demonstration of the FUT linear scar after 3 years follow-up.